Namaskar and welcome to Health Hour by Apollo 24/7 Experts. Every Sunday, we bring you Apollo 24/7 Experts to the live show where you can ask all your questions and we get you answers from the Apollo experts. Also, on this show, we have a health quiz where you can participate and win prizes from Apollo 24/7. And I urge you to download Apollo 24/7 app, which brings you all the benefits of Apollo hospitals and diagnostics, pharmacy, everything into one app, a very convenient app. Also, we are going to give away coupons on this show, which you can use on the app as well. चलिए आज का शो शुरू करते हैं. We're going to talk about women's health, all the myths and facts, because it's the International Women's Day on the 8th of March. And today we are going to talk about how women should take charge of their lives and health. तो आज का एपिसोड हम women के लिए dedicate करने वाले हैं, but it doesn't mean that men should not participate. All the men who are our regular viewers, we request you to please participate and take care of the women in your life as well. आज हमारे साथ एक्सपर्ट आने वाले हैं डॉक्टर अनुराधा पंडा, who is a very experienced obstetrician and gynecologist from Apollo Hospitals, Jubilee Hills, Hyderabad. And मैम आएंगे आपके क्वेश्चंस के सवाल, आपके सवालों के जवाब भी देंगे. And Dr. Anuradha Panda has experience of 27 plus years, and she is an obstetrics and gynecology specialist. Her achievements are: she has an award of Inspiring Gynecologist of South India in 2019, Legend of the Year 2019-20, Times Healthcare Achievers, Golden Aim Award for Excellence and Leadership in Healthcare in 2022. She is a very experienced gynecologist, and she can be consulted for heavy menstrual cycles, fibroids, ovarian cysts, endometriosis, PCOD, infertility, high-risk pregnancies, and recurrent abortions as well. And here we have Dr. Anuradha Panda. Good morning, ma'am. Namaste. Welcome to the show, ma'am. Happy Women's Day in advance to you.
Thank you, and happy Women's Day to all the viewers.
Yes, ma'am. And as March onsets, we call this as the Women's March. So I urge all the viewers to take care of their health, irrespective of what age they are and what kind of work that they do. I think it's important that we women talk about our health in a very confident manner. Ma'am, you being a gynecologist and an obstetrician, you are the one who faces a lot of female patients. So what kind of patients do you think? What do you think that women's health scenario in India today is? How better are we from years ago?
If you ask me, we have improved. Now we find more and more women being aware of things. They
Yes,
are more aware about what they should be doing. They know what is normal, what is abnormal, when they should be coming to the doctor. But still, I feel there are many who are educated, empowered, but still they don't come forward. So I would say women should be aware of things, what is right, when they should be coming to a doctor, and then take care of their own health, see them. And I would say always it is prevention is better than cure. So whenever you have things you feel is abnormal, then you should see a doctor. And we as gynecologists sometimes become the first step. We are more like family physicians for them, because maybe we have delivered them or they have come to us for other issues. We may be the first line for them, and then we direct them and tell them where they should be going and seeing other people and improving things for themselves.
No, absolutely, ma'am. I would say that a gynecologist would be the gateway of women's health. Because that's what has been happening, and thank you so much for protecting our health of India, in fact, I should say. So let me understand कि एक women's health में और एक men's health में क्या फर्क हो सकता है? Or most of the things are common other than the reproductive health. So why should one give a little more detail या ध्यान थोड़ा ज़्यादा क्यों देना चाहिए women's health पर?
Because women's life goes through a number of phases. Like when she's an adolescent, adolescent girl comes to us. That time we feel she just starts her periods. They have a chance of being anemic because she loses blood. Sometimes that is and for women, the peak bone health will be around 30. So they have to build things, and that is the time when they get married, they have children. So they should have a good source of calcium in them, so that the bone health, which is maximum around 30-35, then after that it falls. So that they need a different treatment there. And when they plan pregnancy for the baby, they have to be prepared for they need a counseling. Then they may
Yes.
have a few diseases, they may be having some medication, तो उनको डॉक्टर के पास आके चेक करना चाहिए उनका थायराइड ठीक है, न्यूट्रिशन ठीक है, अगर वो स्मोक करते हैं, ड्रिंक करते हैं या और कुछ सब्सटेंस अब्यूज करते हैं उनको बंद करना है. एंड प्रीनेटली हम लोग कुछ फॉलिक एसिड और B12 विटामिन डी सप्लीमेंट्स देते हैं जिसमें उनका जो प्री कंसेप्शन दे आर प्रिपेयर्ड सो द बेबी हु डेवलप्स इन द वूम, बिकॉज मोस्ट ऑफ द टाइम जब वो हमारे पास आते हैं ऑलरेडी द बेबी इज अराउंड 6 weeks 8 weeks. So most
Yes.
organs, brain is already developed. So pre
Yes.
conception counseling is something they should be careful. Then comes menopause. That's another stage when they lose a lot of things and they need to get checked for a lot of things. So
Yes, ma'am. I
and
think it's important that we talk about what checks that they have to do. So आपने 3 phases बताया है कि puberty है, fertility period है and menopause है. तो इन तीनों को एक एक के बाद एक लेना चाहूंगी मैं because our audience are still joining and you can ask audience, you can ask any question related to women's health. It might not just be sexual health or reproductive health. You can also ask women's general health questions because it is important that you understand कि आपके लाइफ में जो women हैं उनके बारे में भी आप questions पूछ सकते हो. It's not only for women. All the men who are watching the show, please go ahead and ask your questions in the chat box. So, ma'am, आपने बोला था कि प्री प्यूबर्टी में वन काइंड ऑफ हेल्थ अवेयरनेस रहना चाहिए एंड देन बोन डेंसिटी के बारे में भी बात कर रहे थे. क्या चेक करवाना है एंड कौन से एज में व्हेन डू यू थिंक दैट वी शुड स्टार्ट गेटिंग आवरसेल्व्स टेस्टेड एंड व्हाट आर द टेस्ट्स?
about you wanted to know about the puberty or bone puberty, अगर pubertal
प्यूबर्टी
girl है
फर्स्ट टेस्ट मैम. या
okay
फर्स्ट
fine.
टेस्ट इन प्यूबर्टी
Pubertal,
बता देंगे.
yes, like, usually a girl doesn't come in India, at least they are not so aware that they come for a health check for adolescent, though we have some tests there, but they come to us if the period is irregular or they get periods late और उनको ज़्यादा bleeding होता है. That is the time we have to see them and then counsel them to do a few tests, a hemoglobin, a thyroid, and they should have good nutrition. It's important because वो time है जिनका growth spurt, growth phase होता है. Growth spurt के time उनको ज़्यादा protein चाहिए. So growing children will
हाँ.
need more protein, more calcium. That is important. And then a girl will also need to check her hemoglobin, and if she's bleeding more, then thyroid plus iron supplements has to be given to her. So that
Wonderful. Yes,
many
ma'am. Please.
girls in India and women also are anemic. Okay, from
Which
many
is a
we try to
major
have
concern.
Bharat, yes. So that is why not only adolescent, I think all women when they come to us, they look so pale. We'll tell just get a hemoglobin check. We found it 7 grams, 6 grams. That is one thing. And then young girl who comes to us, sometimes now we are more aware of the vaccinations also for the young girls. From the gynecological side, we have the HPV vaccine. We tell
Yes,
young
ma'am.
girls, yes. So if they are
Yes.
coming in the adolescent period till 15 years, they can take 1-2 doses. And after 15, they need 15 to 26 years as the best time till 26. The women come and ask at 45, should I be vaccinated? It doesn't make sense. So in 15 to 25, we give them 3 doses of HPV vaccine. That you asked me, adolescent, they should be aware about that also.
Yes, ma'am. So here I would want our audience to note that Apollo 24/7 is specially curated health packages for women. The entire for on the occasion of International Women's Day, you can call on 1-800-572-1111 and claim these packages because we have curated whatever that a woman requires and जो भी मैम बता रहे आप वो ले सकते टेस्ट कर सकते हैं. Ma'am, I would want here to spend a little time on cervical cancer as well because I have the fact here कि it's the fourth most common cancer in women and the second largest cancer in India, which is killing
Yes.
women.
Yes.
Yes, ma'am. तो something which can be avoided with a vaccine. इसके बारे में ज़्यादा हमने बात नहीं किया है. Women में इतना सारा हमने I don't think we have created awareness. What is your take? And please repeat the vaccine course once again, ma'am.
Yes. One is vaccination. Number two is screening. You have something called a pap test. Who should be taking that? That's important. Any woman after the age of 25 till 64 or 65 years should go for a screening for cervical cancer.
Okay.
Okay, the test is very simple. It's called a pap test, a pap smear. So on screening, we have a pap test, we have a HPV DNA, or we have a co-testing, which takes care of both pap and HPV DNA. Now you will
जी.
ask me how frequently do we do? So we start
हाँ.
around 25. When we do HPV DNA alone, we do after 30. Because why I'm saying the vaccine which I had told, it's for HPV, it's a HPV vaccine. So usually by the age of 30, if somebody has got infected with HPV, it usually gets washed off from the body because of the body's immunity. So after 30 is the time we check for HPV. Before that, we don't. So how often, when should you do it? It should be done after periods, and we shouldn't be doing very close to the menstruation again. The best time would be after periods. And when you go to a gynecologist, you shouldn't be using any vaginal suppository, using a vaginal douche, abstain from sexual intercourse 1 or 2 days, and then go for the test. And that's a very simple test, and the reports will come the next day, and we can see. Then how frequently should you do it?
Yes, ma'am.
See, if you do only a pap test is every 3 years. Now you don't have to do it routinely every year. No, that's a myth again. Every day, every month, every year coming for a pap test. And when you do a co-testing, that is both pap test and HPV DNA, we do it every 5 years till 64
Got it.
65 years, and then we stop screening.
Yes, ma'am. Ma'am, here Saurav Ghosh has asked a question. Vaccines for a 10-year-old girl. I think आपने general vaccines के बारे में पूछा है. That immunization kids के बारे में जो भी है वो आएगा. But HPV vaccine अगर cervical cancer vaccine हम देते हैं तो लड़कियों को कब देना चाहिए? Is it before the puberty or after the puberty?
Now the government is trying to introduce it from 9 years onwards, but we would be more comfortable once they are teens to be given. 9 years you can start giving. 9 to 15 is the best time, they say, because immunogenicity is better. So when you give it from 9 to 15 years, it is 0 first dose, and after 6 or 12 months give the second dose. And in case you miss the second dose or you give it before 6 months, then you have to repeat it again. So it is 0, and then second dose is 6 within 6 to 12 months. But after 15 years, that's a catch up vaccination, what you are saying, 15 to 26. That's also good time to give them, but it should always be given before sexual exposure. So it's better to give
Right.
it before the girl gets married. So don't delay it and give it later. So once you give it from 15 to 26 years, we give the 3 doses, 0, 2 and 6 months. So always make it a point before sexual exposure the girl should be taking. We give it very early in Western countries, where they started at 9 or 11, that way, but before 15 it's better to give them.
All right, मैम. So next वो एज ग्रुप के बारे में हम अगर बात करते हैं, fertile before they reach the fertility, PCOD और PCOS, इसके बारे में थोड़ा हम टाइम स्पेंड करेंगे मैम here, because this is now becoming next rage. इतना हम सुन रहे हैं कि young girls as 15 16 are also turning PCOD and PCOS. So यहाँ I have Kuntala Pavitra. Ma'am, please tell me how to reduce PCOS problem. This is a common problem these days. How do you want to address this, ma'am?
Reduce PCO, I mean, and one more thing we have to, PCO is a condition, we don't know the cause as such, because there are many theories why it's happening, maybe genetic, maybe sedentary life, maybe familial, but and sometimes these people are very prone to obesity, infertility sometimes, and irregular periods. How they come to us is irregular periods. They have
Correct.
periods every 2 months, 3 months, and then after that they start bleeding and the bleeding doesn't stop. That is abnormal bleeding. They may come to us with infertility. They're trying to get pregnant, they don't get pregnant. Sometimes they come to us with extra hair, acne, and sometimes they go even to a dermatologist who sends them in turn to us, because acne, hirsutism may be external manifestation of the disease. But some people, we have lot obesity, and we have features of hyperestrogenism, hyperandrogenism. They have
हाँ.
more of acne, pimples, and they have hyperinsulinemia. They have pigmentation on the neck, darkening on the neck. Those are the signs of hyperinsulinism. So these are all the features of PCO. And along with that, sometimes people come with a scan report saying we have PCO on scan. But if you have no symptoms, only it is seen on scan, you have to be little on the lookout, but we won't treat you. So what her
Okay.
question was, How will you treat?
Yes,
What
ma'am.
will
How
the
to reduce PCOS problem is the question that
So
she had.
first thing is lifestyle management. First thing is
Yes, ma'am.
exercise, diet. Those are the first thing we would say rather than giving you medicines in the first day. And you have to keep things in check like diabetes, hypertension. It's not like the PCO will go. We put you on pills or birth control pills, OC pills for months. Then maybe your ultrasound may not show, but it will again recur once you stop the pills. So it is better to keep the disease under check. If you are reducing weight, you maintain a better lifestyle, you may not need more medicines. That's
Yes, ma'am.
important.
And here, food के बारे में आप lifestyle बता रहे थे कि how important it is to be active. PCOD ఒక disease కాదండి, PCOS or PCO ఒక disease కాదు, ఒక condition కాబట్టి మేడం ఏం చెప్పారంటే ఇప్పుడు మీరు కొంత వరకు బరువు తగ్గడము, లైఫ్ స్టైల్లో యాక్టివ్గా ఉండడము, అలాగే మిగతా మిగతా కార్యక్రమాలు అంటే మందులు మాత్రమే కాదు అనేది ఇంపార్టెంట్ అని చెప్పారు. I have another question here, ma'am. Neha Mondal, who is 25-year-old female. Which foods can help me to regularize periods if I have PCOD or PCOS? And diet का role क्या है मैम यहाँ पर?
Most important, which food to avoid if you have PCO. You
Ah,
should be
yes.
yes, you should be avoiding junk food, oily, fatty food. You shouldn't have very sugary food. All these soft drinks and all should be avoided. You should have more of fibers, more of fruits, vegetables. You should have proteins, nuts. So they give you omega-3 fatty acid. You should, and all we have seen, most polycystic ovary patients are vitamin D deficient. So you will need even vitamin D supplementation and calcium. It's better when you have a PCO, you have to check your sugar. Even your HbA1c should be checked. You should be checking your lipids because you are more prone to having dyslipidemias, the cholesterols, abnormal cholesterols. Then you are more prone to have vitamin D deficiency. And some women, because they have periods of amenorrhea followed by heavy bleeding, they become anemic, and that's the time when they come to us with hemoglobin 5, 6, 7. So they should take care of the diet also and increase the iron intake. They should have more of calcium and vitamin D, more of protein, nuts and fibers, and avoid refined carbohydrates. मैदा एंड ऑल जो लेते हैं वो ये करना है, more fiber rich food लेना है. Fruits you can take, but take fruits which don't release the sugar very fast. Know about the glycemic index, that is what you should take with very slow release. And they are more prone to diabetes, more prone to hypertension. That is why
Yes.
exercise at least 5 days in a week, and they can do whatever exercise they want. Exercise, walking, at least 45 minutes in the day is something we advise, and we tell them at least reduce 10% of your body weight. We give figures, but reduce 10 kg, 15 kg, that doesn't happen because most of the time they come back and say we are doing so many things, we don't reduce. So keep a target as 10% of what your body weight is. Slowly try to
तो
reduce.
एक एग्जाम्पल देने के लिए अगर कोई 80 किलोज है, somebody is 80 kilos, so 10% is 8 kilos of weight अगर वो घटते हैं तो भी उनका हेल्प हो जाएगा.
Yes.
राइट. सो मैम आपने अभी जो टेस्ट बताया है, अगर पीसीओडी कोई किसी को है, सो दे हैव टू मॉनिटर देयर HbA1c, दैट इज डायबिटीज मॉनिटर करना है, उनको ग्लूकोज, लिपिड प्रोफाइल करवाना है, डी एंड कैल्शियम चेक में रखना है, एनीमिया के लिए सीडीसी करना है,
Thyroid,
एंड या
thyroid.
थायराइड भी करवाना है. So all these tests Apollo 24/7 पे आप order कर सकते हैं. There are also health packages curated for women, especially on the March 8th International Women's Day के concern पर. All these are on Apollo 24/7, or there's a number which is running on the screen that you can call and book your tests as well. So, ma'am, this is very important to understand. This might lead to infertility or any other issues. Let me also take another question here. Uh, इनका क्वेश्चन है स्नेहसिस गुहा. My wife is 28-year-old. She's gone through a laparoscopy for an ovarian cyst, and after 3 months, AMH level reduced to 1.31. Will this cause any problem for pregnancy?
1.31 is a low AMH. At that age, more than 2 is always a favorable one. So, was your AMH done before your surgery? You can't always blame surgery for the reduction of AMH because I think cystectomy, only one cyst was, he has to give in some more history. Was it a unilateral cyst or a bilateral cyst? And if AMH was done before. There are some medications to increase your AMH. We do give them DHAs and all, but most of the time they has to go and consult the doctor who has done the surgery. So she may help her in what would you say? If it is lower than 2, always get a LH-FSH done. Just don't think about the ovarian reserve. Get your LH-FSH estradiol done on the second and third day of the period. And then if that is also on the higher side, then maybe you need more immediate treatment, or any additional fertility treatment may be necessary for you. And you have to see something called antral follicle count, which we see. Then basing on all that, your gynecologist will be able to help you more.
Yes, and Dr. Anuradha Panda will be available on Apollo 24/7 as well. Her appointment link is given on the chat box. You can, in case you want to consult her, her link is there on the chat box. Ma'am, another fertility related question. Supraja, 35-year-old female, what to do to conceive when egg count is less?
Yeah, when egg count is less, I think if you have been investigated by a infertility, you have found the egg count is less, AMH is less, I think you need follicular study to see you are really ovulating or not. It's better not to waste too long. If your AMH is less, your egg count is less, go for any ART treatment. That would be a better option. It's better to monitor things, see if you are maybe for 1 or 2 cycles, see if you don't conceive, then it's better to go for ART.
Yes, ma'am. Shikha Jain का question है. Shikha Jain, 44-year-old, suffering from frequent urination from last 2-3 years. Before periods, I suffer from wetness and frequent urination, and sometimes my periods also get skipped.
At 44, you are in the perimenopausal period. Sometimes it may get a little skipped, but if it's too irregular and after the irregular period you are having um, heavy flow, then you need to consult a doctor. And the second question was wetness before period. Actually, sometimes your before period your vaginal secretion will be little more than normal. So if it's not itchy, not odorous, it's not causing too much of a issue for you, then you can take it as normal. But you're 44, just see your gynecologist. You can get a pap smear done. If you think it is itchy, or it gives you any odor, or it is much more and copious, or it is blood stained, those are the things better see your gynecologist. And the third question, for what was the third question?
That's it, ma'am. Frequent urination tha, and periods also get skipped.
If you're having, get a urine routine and urine culture done. If it's associated with burning and any other issues, then you have to think about urinary tract infection. But if it's passing very small quantity with burning and pain in the abdomen, you have to get a urine routine and urine culture done, and then see your gynecologist. And are you diabetic? That's a question you never, I
Yes.
mean, if you are
Yes,
diabetic,
we should
you are
also.
infections.
Yes.
So even
So
your
all the
that part has to be
you
checked.
get yourself, Shikaji, get yourself examined. I think this is the best time. Women's March है, women's health awareness spread करते हैं. तो आप अपना health के बारे में, if you are concerned, go ahead, take charge and get all the tests done. And all these tests are available on Apollo 24/7 as well. Ma'am, next question I want to take is extreme mood swings during periods. Soma Vishwas, 35-year-old.
It's not only during periods, it's more before periods. That is called a premenstrual PMS, premenstrual syndrome. So here people have mood swings, many people have anxiety, some people have depression, some people have body pains, breast pain, bloating. Those are all the symptoms, and it is depends on the hormonal. That is because your estrogen comes down, and then sudden you get your period, all the hormones come down, and that can cause a effect on your mood. It can cause an effect on all these body somatic disturbances you can have. And what is the treatment for it? Well, we will again say, if you're having lot of coffee, you're having lot of tea, that you should cut down. Sugary food you should cut down. It is seen in women who are more sedentary, so it's better you increase your exercise. And sometimes we give you some medications like vitamin E, primrose oil, and if it's too much of a mood swing, then you have to go on OC pills or some SSRIs. That, I
Ma'am,
think,
here,
that is a
anyway,
basis
yeah.
you have to go see your doctor.
Yes, ma'am. Here I would also want to talk about postpartum depression की delivery के बाद जो mood swings होते हैं. स्केल बदलते रहता है, किसी के बेबी ब्लूज बोले जाते हैं और पोस्टपार्टम डिप्रेशन में काफ़ी सारा चेंज देखा जाता है. We are not really as a society have started to address women's mental health and also postpartum depression on the whole. So would you want to throw some light on that, ma'am?
Postpartum depression is not very common, but well, we do find women, and that is when they come with the child on the first visit and they tell us they are feeling like crying, they feel very depressed, they don't sleep well, and first, and they people who are prone are people who previously have things like little bit of depression and all, they get more prone. But de novo also people may get depression, and that is mainly some that is when we want the support of the spouse, the mother-in-law, and people in the family. She should sleep well and get adequate sleep, adequate nutrition at that time, and she should be helped with the baby. And sometimes what happens, the focus directly changes from her. When she's pregnant, she got a lot of attention, and then everything shifts to the baby. So that also sometimes has an effect. So I think that if it's too much, sometimes we say go and see a psychiatrist and you may need some medication if it's too much. Otherwise, if it is mild or moderate, we can counsel them and see if they improve, because that time we have to take care of her, and sometimes see if she's too much depressed, she may not be able to take care of the baby.
Yes, ma'am.
So that
And
all
also, ma'am,
has.
do hormones have a role in postpartum depression? And can there be mood swings also in the, if not depression, tak nahi, but can there also be mood swings post delivery?
Post delivery, yeah, they get mood swings. Even during pregnancy, some people, because of the hormonal effect, they do get mood swings. But post delivery, it is common. It is not, I mean, we'll say we have maybe, I can't exactly say the rate in the Indian population, but we have quite some women coming and telling us. It's too much, we
Oh,
refer them to a
to
psychiatrist.
psychology or a psychiatric help.
Thing that we tell
Yeah.
them, but still, I think say they may need a little bit of help there.
Yes. Next question is from Mr. Krishna Kittur. Is it necessary for a woman above 60 years to take vitamin D and calcium supplement regularly? And also इन्होंने मैमोग्राम के बारे में भी पूछा है कि कब मैमोग्राम करवाना चाहिए, especially women after 50-year old.
मैमोग्राम आफ्टर 50 तो जरूर करना चाहिए. गाइडलाइंस के हिसाब से सम गाइडलाइंस से सम 40, सम से 45, but by 50 you should surely have a mammogram. And when should you be doing it is whether we can do it every 2 years or every 1 year, depending if somebody has a family history, they can do it at every 1 year. Otherwise, even 2 years is good enough. And not only a mammogram, and they have to do at least till 70. We can allow, actually allow them to get it done. And what more important is a breast self examination. When you are talking about mammogram, they should know about a breast self examination. All women after period can check their own breast. Okay, that's the
Yes.
best time when there's less of lumpiness. They have to check their own breast, and they will know any change in consistency, any lump. That is important. First, it should be a
Yes.
visual. I think they should go through the YouTube. They will know. First, a visual examination. Then they have to go in quadrant. They have to use this place of the, I mean, the fingers. Yeah, not the tip.
Yeah.
This one, and they have to go round in circles from
Palpate.
outside to inside with different pressure. Then from out to in, like quadrant checks. At the end, they have to check around the nipple and then press the nipple and see for any nipple discharge.
Okay.
And if they find
So
any lumps or anything, to see the doctor.
all right. So it's important to know what is a normal, regular breast on different phases of period. Knowing our own body is very important. We should not shy away. कि discharges होते हैं, nipple से हो सकता है, vaginal discharge हो सकता है. I was looking at a question of vaginal discharge के बारे में question. All right, ma'am. I'll come back to that whenever I find a question, ma'am. Next question I would want to take up is. Uh, Hypothyroidism. Ritika Prabhu, 27-year-old female. I've been diagnosed with hypothyroidism for over 2 years now. I've not seen any results with the tablets or exercise. So how do I control my TSH? मैम ये women and thyroid काफी सारा सुन रहे हैं, स्पेशली प्री प्रेगनेंसी एंड पोस्ट प्रेगनेंसी बहुत सुनते हैं.
Thyroid is common, and what she said, medication से तो कम होना चाहिए. It's not like she has to take the medication properly. And you said pre-pregnancy, post-pregnancy. Pre-pregnancy we always want to check, because thyroid is very important for the baby's nerve development, brain development. So we need to make the thyroid a TSH within normal limits, and then she should plan pregnancy. She should become euthyroid. That's what we say. It should be within the normal limit, and then she should plan pregnancy. That is one. And
Yeah.
post pregnancy, usually when she gets pregnant, the dose of thyroid, I mean thyroid hormone, will be increased. She may have to take a higher dose, and then once she delivers, again she can come back to her old dose. That is
Okay.
important. And exercise, तो exercise करना है, but exercise and diet के thyroid कम नहीं होगा. उनको तो thyroid का medicine लेना पड़ेगा every time, and she has to see if she is there's lot of fluctuations. She has to even do her antithyroid antibody. Those who have that antibody positive, they need more of titration of the thyroid hormone.
सो ऑल्सो मैम हियर कि एक डोज एक महीने में या एक ही तरह का डोज सबको नहीं चलता है, एंड देन दिस इज समथिंग वेयर you require your endocrinologist or a general physician internal medicine to tell you what dose you require at a different phase. तो हम women में ना मैम एक स्टिक हो जाने का एक मेंटालिटी है कि डॉक्टर ने कभी दिया है मैं वो आई एम यूजिंग दिस.
Yes.
सो ये वुमेन में काफी हद तक जिद्दी रहते हैं. आई थिंक मोस्ट ऑफ द मेन इन द हाउस होल्ड ऑल्सो कंप्लेन दैट वीमेन डोंट कम फॉरवर्ड कि वो बताते हैं कि ये करना है ये मेडिसिन लेना है. दे डोंट लाइक द चेंज एज मच. डू यू ऑल्सो फाइंड दैट वुमेन आर रिजिड इन सर्टन सर्कमस्टेंसेस?
They are very rigid, and they do a lot of self medication, which should not be done. Self medication should be a strict no.
Yes, ma'am. Yes, ma'am. Ma'am, next question is Winnie, 31-year-old female. My nipples give discharge or lactate even when not pregnant. What do you do if you want to start lactating? If I'm starting to lactate without getting pregnant?
That is something what we call a galactorrhea, nipple discharge. Is it milky discharge? First thing that we need to know, is watery discharge. And sometimes that is related to thyroid. If you are hypothyroid, you may have that, or increased prolactin, hyperprolactinemia. So she needs to first check her thyroid and prolactin check is done early in the morning fasting. So she needs to take both her thyroid hormone and a prolactin, and then she has to see. But first she needs to know whether it's watery or it is milky. And sometimes post delivery also people may have, like, I mean, they are breastfeeding, so we are not bothered. But after stopping breastfeeding also, they may have, maybe for 6 months or 1 year, they may still have milk discharge. That is normal. And if
Okay.
seeing these hormones, we have to put her on medication to reduce that discharge, milk discharge.
So this is a rare condition, ma'am. ये तो काफी
Not
सब में नहीं
rare,
होता है ना?
not very rare. And one more thing I should say, some medicines cause milk discharge. She should know which medicine, if she's on any medication. People
Oh,
rampantly take this Pandi and domperidone and all, will cause milk discharge. So they keep
okay.
taking that. That she also she should know. And some other medical tablets also can give you, like some antipsychotic medications also can give you that. So that she has to see, or see a doctor after doing those two tests.
Very important factor that you mentioned, ma'am, because we need to observe कि क्या हो रहा है और कौन से किसके reason से ये हो रहा है. Next question is from, इनका नाम नहीं दिया है, but 28-year-old female है, health, hope, happiness, unmarried, no comorbidities, I feel heaviness in the breast and it pains sometimes before the periods. It gets normal after the period. What is the reason?
That is hormone dependent. So she did not worry at all. That's a normal phenomenon. Many people do have that. So she has to
Okay.
take a good breast support. Yeah. And I don't think we treat that unless it is too painful. Then you may have to take medication. Even evening primrose oil and all can help her. And if it's really bad, then we need to bother. Otherwise, many people, that's something we need to tell people. Whenever they have pain, they in the breast, they come running to the doctor. But when they have a painless lump, they never come, and it's the painless lump which is more important. Many cancers, most of them will be painless lumps in the breast. People just see it's a painless lump. I had it 6 months ochindi, అది ఏం symptoms ఏం లేవు, చూడలేదు. Then they come to a doctor, and then I think they unnecessarily waste those few months.
yes, it's very important कि इतना breast cancer का rise है. ఇంత మంది మన చిన్న పిల్లల్లో కూడా breast cancer, young girls లో కూడా breast cancer చూస్తున్నాం కాబట్టి awareness ఇంకా చాలా పెంచాలి అని నేను అనుకుంటున్నాను. And do observe the changes in your own body and reach out to the medical professional well in time. That's the best cure for cancer, especially when there are certain cancers like cervical cancer, ma'am, which can be prevented. At least next generation will be entire next generation can be covered, which gives me hope and positivity. And awareness is the only key that we can give to our women. So that's where today's episode is dedicated to women and health packages which are specially curated by Apollo doctors. Please make sure that your women in your life get their tests done. Ma'am, menopause के बारे में ज़्यादा बात नहीं किया है हमने. Would you want to talk about how a woman's life changes, quality of life or health changes after menopause? And what are the tests, ma'am?
Menopause is actually a very stressful period for women. The normal age in India is around 48 to 52. So that is the time. And but the time before menopause, premenopausal period, also woman experiences a lot of abnormality in the period. She gets sometimes those mood swings, hot flashes, sweating, anxiety, then night sweats, disturbed sleep, and that is another time when they feel very depressed. What you say about this depression, we have more of depression, more of anxiety during this period. And one thing I should tell them is that is again a phase and it will pass. But when you have these symptoms, we have treatment for that. It's not like you stay home and don't consult people. There's something called hormone replacement therapy, HRT. So you can also take that. After we do a few preliminary checks, we do tell you what HRT to take so that you don't have those flushes and you don't have those
Yeah.
night sweats, you don't have those mood swings. It's not only those symptoms, physical symptoms, you have more of this urinary tract infection, vaginal dryness, vaginal burning, then your bone density becomes more, so you need more calcium. You may need even you are doing a pap smear mammogram, get a BMD done also to know the bone density. And you sometimes people may get hypertensive, diabetic at that time, more prone if they are not before, and these may be the symptoms and they never have got themselves checked. So that time you need a thyroid, you need your sugars and everything, hemoglobin to be checked also during that time. And then the other thing would be we find that we need women at that phase need more of exercise, a good diet, more of calcium again because her bone mineral density will be falling. She will need more of calcium, more of vitamin D, and she is what will you say? She needs supplements also. And sometimes we give them HRT, we give them more, we ask them to take more of soya isoflavones that has phytoestrogens like estrogen like things, and that will also help her get over that.
Yes,
And
ma'am.
sometimes
Ma'am, here
for
bone mineral density test के बारे में आपने बताया है. So osteoporosis in women, especially menopause related osteoporosis, which puts women in danger. Mobility, अगर कहीं fractures हो सकते हैं या lot of life quality of life is compromised. So it is osteoporosis and menopause का link क्या है, ma'am?
see, as I told you earlier, 30-35 years में bone peak होता है. उसके बाद bone density कम होता जाता है usually. And in women it is more common. It's common to get osteopenic and then osteoporosis. Usually menopause they get osteopenia normally. It's not that depends on the T-score, -1 to -2.5, and below that will be osteoporosis. So osteopenia, it's important that we prevent and take it at that osteopenia stage and don't go towards osteoporosis. That's why we keep on saying कि delivery के बाद, pregnancy में, delivery के बाद actually when a woman lactates, she needs more calcium than pregnant. So till she is breastfeeding, उनको calcium लेना चाहिए. नहीं, बहुत वुमेन को हम लोग देखे 2-3 मंथ लेंगे, उसके बाद कैल्शियम बंद कर देंगे, because that is
जी
important that they replenish their calcium when they are breastfeeding. And then women sometimes have successive deliveries. That's also not good, because your
राइट
own
राइट
nutrition, your calcium, your mineral, everything should be replenished before you get pregnant again. So that is something we have to tell them. And vitamin D भी हम लोग बोलेंगे around 2000 international unit per day लेना है. They can get that vitamin D and calcium also checked, so that's important. And they can get a BMD also done to know the stage
या
of their
Yes.
bone
So
density.
Aditi is asking a simple question here, but I think we have already answered. But I would want to take up the question. 28-year-old female है, how to increase bone density? अगर pregnancy नहीं है, फिर भी bone density कम है, तो how does one increase?
One is your diet, vitamin D, calcium, rich food लेना है, plus sunlight में रहना है. And one other thing is exercise. Your bone density will increase when you exercise. Weight bearing exercise should be done. Another thing, walking, jogging, all that will increase. If you exercise, your BMD will increase. With a good diet, it will increase. And you have to take supplements if they are low. I mean, calcium or
Yes.
vitamin D, that she's not pregnant or anything, should be okay at 28, I think, but she can maintain it with good exercise.
Yes, ma'am.
At 28,
Ma'am,
then, yeah, sorry, yeah.
yes, please continue, ma'am. हाँ.
No, no, tell me. Yeah.
No, next question लेना था मुझे. आप 28 एज है उनका, वो
28
you
में
want to
usually हम लोग supplements नहीं देते unless they are pregnant or they are lactating. She can do the exercises. I can see how things are, and then supplements we can check if she feels lot of bone pain. But now we find in India, in spite of the sunlight, most of the us are vitamin D deficient. So she can also
Yes.
check her vitamin D and then take supplements if there need be.
Yeah. So Shweta is asking, what's the best time to conceive a baby period में? कौन सा time best है try करने के लिए? And could one have intercourse during periods and pregnancy?
First is the time, that is the ovulatory phase. So when a woman has a cycle every 30 days to 30 days, the fertile period will be 10th, 11th day to 14th day. But when she has, she doesn't know if the period is irregular, sometimes we don't know around the fertile, we won't know the ovulatory cycle, but there is something like changes in the vaginal mucus, which becomes very watery before ovulation, and after ovulation it becomes thicker because of the progesterone effect. Okay, and that middle period ovulatory phase, the time she should try for pregnancy. That's number one. Then number two is her question is
Intercourse during periods
age,
and
age,
pregnancy.
age, age. Actually, now women are going very late for pregnancy, which is sometimes the trend is after 30, 35. See, after 30, the I mean, the egg reserve also comes down for a normal woman. So we will not like unnecessary people delaying pregnancy and then getting panicky that 30, 31, I didn't conceive, but they waste their time before that. So I would suggest now with everybody working and all, we don't tell them go get pregnant very early. But 30, beyond 30 wouldn't be very good. It will be better if you conceive before 30. And that is one. And when some people come at 30, 35, 36, 37, then you are more prone for diabetes, for hypertension, which can add on to risks in pregnancy. Even
Okay,
if
ma'am.
you don't have any
Intercourse
comorbid,
during periods and pregnancy. That was her next question, ma'am.
during period is no. Because not only is the hygiene part, sometimes we see during pregnancy, I mean during periods, you are more prone to have endometriosis. If you have, so we said no during period.
Ma'am, I know we are
Very,
running short of time. So if
yeah,
quickly, अगर आप देंगे तो three questions, yeah, three
first,
more questions.
yeah, sorry. First trimester we say to avoid, last trimester we say avoid. In between it is okay. But the other thing is, if somebody has pain or cramps after intercourse during pregnancy, it's better to avoid even if it's mid trimester.
Yes, ma'am. Thank you so much there. Ma'am, we haven't talked about endometriosis and fibroids and the bulky uterus. Hysterectomy के बारे में ज़्यादा हमने बात नहीं किया है. When we talk about reproductive health, it is important to talk about endometriosis as well, no ma'am? Your quick take on it.
Reproductive health, I would say, rather than endometriosis, what we have to be more aware is when you say sexual and reproductive health in a woman, she has to take care of that herself because she has rights. rights when to have a child, that's important, when not to have a child. There's something called contraception available. That's something, when you asked me, I would say that she can take contraception, which can be pills, which can be a intrauterine device, or it can be even a injection. And the third thing is, she should know now, with all these new MTP acts coming in, she should know also that MTP is something, I mean, with unwanted pregnancy, you have to make your I mean, it shouldn't be unwanted pregnancy, number one. And when you don't want a pregnancy, you have abortion services available to the government of India or outside, and the woman is the sole person who can decide
Can
on that,
decide.
the husband. Yes, that is what, when you say sexual reproductive health, this is something she should know. That is her
Yeah,
A and not her husband or family A also. With now, with more of women empowerment, we feel that women should get pregnant when she wants to, and it shouldn't
correct.
be forced on her, and it shouldn't be unwanted pregnancy. When we are around, like doctors around, with everything legalized in India, they shouldn't be going to cracks and having unsafe abortion.
And exactly, ma'am, India, that way we have become pioneers in talking about reproductive health and especially rights of termination of pregnancy and women. I think we are leading the world here, ma'am. And quickly, ma'am, the sexually transmitted diseases के बारे में, women think that it's a myth that single partner है, मेरे लिए STD या sexually transmitted disease नहीं आएगा. Is that a myth, ma'am?
It is not a myth. Actually, STD is more common in people who have multiple sexual partners. Okay, that's not a myth. It is a fact that if you have multiple sexual partners, you will have STD, more prone. Another thing is a safe sex. Use a condom, so that prevents you from having sexually transmitted diseases. That is
Yes.
important.
So yeah, Riya Sarkar Swarnakar is asking, 23-year-old female, how can I treat vaginal infection? Sometimes I have itching in my vagina. So ये general itching and infection क्या होता है, and STD में क्या difference है? What are the ways that one can identify, ma'am?
Just itching and yeah is not a sign of STD. STDs will have, I mean, there are more common ones like syphilis, you have chlamydia, you have herpes, you have HPV,
Gonorrhea.
gonorrhea, yes, and then trichomoniasis. These are STDs. They may manifest with discharge, which may be itchy. You may have ulcers. You may have even small fall vesicles all over. You may have warts. These are important. Warty lesions also. This is a sign of HPV. So sometimes, like in chlamydia infection, a woman may not have much of symptoms, and then she doesn't get pregnant because it causes blockage of her tubes. Okay, but when you have a vaginal infection, that can be for many reasons. If
Could
it's
be
itchy
simple
and
bacteria.
yeah, when it's itchy, it can be a fungal infection, it can be trichomoniasis. So when your doctor puts in a speculum, she will know. And we have some tests which we do to know what it is. And sometimes if you have taken antibiotics, then you are more prone after that to get fungal infection, where it is curdy discharge which sticks to the side wall, it's burning, and you have even urinary symptoms there. You have burning urination also, you have discharge which is curdy and itchy. And when you are diabetic also, you are more prone for that.
Yeah, so right help के लिए you have to identify what kind of itching and discharge is there, and that's when your health practitioner will be able to guide you. So all these tests are available, and Dr. Anuradha Panda can be consulted on Apollo 24/7 as well. Download the app, and there's a link which is given on the chat box as well. There are tests which you can take. I think, ma'am, we should conclude this session on reiterating how women can take care of their health and top tips and taking charge of their health, please.
Tips, I would say, women, what you have mentioned, women should take care of their own health, make it a priority, go for regular checks so that they know and they can prevent things and not cure it. Prevention is better than cure, as I said. And it is important that they exercise, take a nutritious diet, and though we are all busy, we should impart, I mean, give a little time to our health issue and not wait for people to take us to a doctor. Make it your own responsibility, get yourself checked and be healthy.
Wonderful, ma'am. Thank you so much. I think this is a very, very essential discussion. I know that most of the men who are a regular participation, जो होता है हमारा, they have refrained from asking questions. But I request, you have seen the show, you have seen what Dr. Anuradha had to share. It is important to empower your women and give them information and facilitate so that they can go ahead and take charge of their health. Thank you so much, Dr. Anuradha Garu. Happy Women's Day in advance. Thank you so much.
Thank you.
So that is Dr. Anuradha Panda, an obstetrician gynecologist from Apollo Hospitals, Jubilee Hills, Hyderabad, answering all your questions there. Thank you so much once again, ma'am. And I will continue with health quiz and health coupons coming up. तो चलिए अभी हम हेल्थ क्विज कर लेते हैं. Here are the rules for the health quiz. You have to answer the questions. I'm going to ask you 3 questions. You need to answer these 3 questions on YouTube chat only. You might be watching this on Apollo's all the Facebook pages. And if you are the winner, I will be announcing the winners towards the end of the show. And winners will be selected at the sole discretion of Apollo 24/7's team. And if I take your name as the winner, then you have to write back to us with all your contact details at marketing@apollo247.com. And gift vouchers shall be shared with you. तो चलिए हेल्थ क्विज के 3 क्वेश्चंस डाल देती हूँ आपके सामने. The first question is true or false में आंसर कीजिए. Cervical cancer is the 4th most common cancer in women globally. True or false? Cervical cancer is the 4th most common cancer in the world in women globally. Question number 2, fill in the blank. International Women's Day falls on dash. The date I want falls on which date on March annually? Yes or no? Postpartum depression also includes other mood disorders. Yes or no? So these are the 3 questions that we have asked on Health Quiz this week. Go ahead, type your answers on YouTube chat. I see that people are answering already. तो अभी coupons के लिए चलते हैं. Download Apollo 24/7 and here are the coupons that you can use on Apollo 24/7. Consult top doctors direct from Apollo. 150 cashback मिलेगा आपको when you consult online doctors on online consultation. Use the code AskDoc150 ASKDOC150 and don't wait till things are out of your hand. Consult Apollo doctors and use the code AskDoc150. Next coupon that we are giving you is when you order medicines direct from Apollo, you get up to 25% off on online medicine orders, and the code that you need to use is FIRST3 FIRST FIRST3, and this discount is valid on the first 3 orders of ₹1,000 and above, and you also get up to 2-hour delivery when you order from Apollo 24/7. And the best part is that Apollo 24/7 app आपको मेडिकल टेस्ट बुक करवाने देगा, आपके मेडिसिन ऑर्डर करवाने देगा, and then also consult doctors. With all these benefits, you should download Apollo 24/7. And here's the next coupon for our health viewers. Use the code HH247. Get up to $199 off on online consultation with Apollo doctors and up to 20% off on medicine orders. This code is in addition to the other codes that I have mentioned earlier. You can use this. This is exclusive for our health viewers. Thank you so much all of you for joining, and let me also remind you that Apollo 24/7 is also on WhatsApp. अभी आपको स्क्रीन पे एक नंबर दिखाई देगा. You can call or text on WhatsApp 09355 to avail all the healthcare services of the app. It's just a call away now. You can book tests or order medicines on WhatsApp as well. So there are a lot of people who are participating. I see, yes, Tajinder, Anmol, Snehasis, Surinder Jandial, Health, Hope, Happiness. A lot of you have answered. Now I'm going to announce the winners. Congratulations, winners. Bouncy0103, Snehasis Goha, and Anmol Agarwal. Congratulations. I repeat, the winners will also be mentioned in the chat box. You need to write back to us to avail your gift coupons. Congratulations, Bouncy0103, Snehasis Guha, and Anmol Agarwal. तो चलिए, thank you so much for joining us this Sunday. फिर next Sunday मिलते हैं, and next Sunday we are going to talk about the A to Z about stomach infections. सो 12th मार्च संडे 11 AM ज्वाइन हो जाइए अपोलो 24/7 के हेल्थ आवर पर एंड मेक श्योर यू लाइक, subscribe and share these very important discussions. If you subscribe our channel, you are empowered with health information, and I promise you that this is not going to be a waste of your time. This is going to be empowerment for your own sake. तो नेक्स्ट हफ्ते मिलते हैं संडे 11 AM. नमस्कार. Thank you so much for joining us this Sunday.